The important thing to do then is to check your blood sugars on a regular basis to make sure that you are staying within that suggested or recommended range. Things that might throw you off, that make your blood sugars go haywire and throw you out of range, would be not eating properly. And that's something you can figure out on your own. When you're checking your blood sugars, again, I would recommend that you write down what you eat, at least for a couple of days, maybe a week or so, and then check your blood sugar afterwards to see how that particular food affected you. Also, your medications. You can make some changes in your medications. You might want I would suggest that you talk to your doctor, your nurse, your healthcare professional, whoever that might be at first, to get some kind of guidelines on how they want you to adjust your blood sugars or to adjust your medications to achieve that normal blood sugar. And once they know that you know what you're doing and you're kind of on the road with that, then they'll allow you to do it yourself. Exercise lowers your blood sugar significantly. So if you know you're going to be exercising, you might need to either cut back on your medication a wee bit, or maybe you need to have an extra snack. Exercise that's planned is easy to do. Unplanned activities, such as you have a flat tire, your dog gets out and you're chasing it down the street, the washing machine runs over and you have to clean out the garage, your grandkids are sick and they come over to stay with you for the day, that might be a lot more activity than what you were planning. In that case, if you cannot make changes in your medication, you might want to have a couple of extra carbohydrates, or foods that actually raise your blood sugar to keep your blood sugar at a more stable level. Other things that can affect your blood sugar are things like illness, infection, fever. Anytime you get sick, if you have an abscessed tooth, if you have a bad urinary tract infection, a bad cold, things like that can also make your blood sugar go up. Certain medications can throw your diabetes out of control. So again, during those periods of time, it's very important that you check your blood sugars closely to see if you need to make some changes either in your diet or your medication. Other things that can make your blood sugar go up is any kind of stress. A lot of people, when they're in pain, it will make their blood sugars go up. Now, that's not to say it's okay. You know, I have people come in, well, I was in pain for the last 3 months. That's why my blood sugars were too high. If you're having constant stress, being from pain, the loss of a job, other family members being ill, there's a variety of things that can be stressful to you. You still need to deal with it. You need to either call your healthcare provider and, again, make changes in your medication, or remanipulate your diet to make sure you're keeping yourself within those recommended glucose goals, or maybe bump up your exercise some.